Tuesdays. We're coming at you live from the Element Well studio. We welcome now Dr. Katherine Pannel. She's a DO and medical director of Right Track Medical Group and legislative chairwoman of the Mississippi Psychiatric Association. We also have on the line Agnie Fletcher, a teacher from Laurel, Mississippi, who lost her brother to a Kratom overdose last year. Dr. Pannel, Agnie, thanks for joining us.
Thank you for having me.
Thank you so much, yes.
You bet. So we wanted to get you on in response to a discussion we had last week with an individual who uses this substance, Kratom, to fight their bout with alcohol and pain, chronic pain. And we also had a physician on as well. And both of them see things, I think, a little differently than you guys do. They support relaxation of regulations of this substance. But you guys have a different take on it. Dr. Pannel, tell us about your concerns about Kratom and perhaps deregulating it and de-restricting it.
You know, there's a lot of misinformation out there about Kratom. And if you go and you look on the American Kratom Association's website, they tout it as being like a safe, all-natural alternative for energy and pain control. But what they don't tell you about is all the hidden dangers of Kratom. The FDA has already established that Kratom is an opioid. It works on the same receptors as things such as fentanyl, heroin, and any other opiates. So at a low dose, it has a stimulant effect. At a high dose, it has some pain control effects, but it's also highly addictive and can be deadly in overdose.
Okay. So, Agnie, tell us your story with respect to your brother.
Thank you so much for having me on. I actually want to read this so that I don't leave out any details. First of all, thank you for having me on. The story of Matt Everett, my brother, is very dear to my heart. After a lifelong battle with addiction, Matt was found deceased in his bed on the afternoon of July the 24th, 2024, at the age of 52. Now, Matt did battle almost every drug and completed rehab about 4 times throughout his life, defeating each addiction that he suffered from. But after a heartbreaking divorce, Matt found Kratom, which was sold in a small bottle at a local gas station near our home, and his life completely changed as it numbed his emotional pain as well as his back pain. This new habit was very costly for him. He ended up losing his lake house, his truck, another truck that our mom gave him, a car, his part-time job, as well as all of his possessions. Matt lived with our elderly mom and began to lie, steal, and pawn her possessions as well. And this was not like him at all. After Matt's death, we discovered paperwork revealing that he was borrowing money from various loan companies, not paying them back. We also retrieved our mom's prized jewelry, Matt's laptop and sunglasses, but mom's gun, personal computer, and a whole lot of other stuff had already been sold. Hidden in a bag in Matt's room were other sentimental items that we found that he was apparently days away from pawning, which included our mom's precious wedding ring. Our mother was taken advantage of due to her age and vulnerable mental state. And after Matt's death, I taught her how to download her banking app, only to discover that close to around $60 a day, give or take, was spent every day at gas stations and smoke shops, totaling around $10,000 in his last 6 months on this earth. Mom was 3 months behind on all of her utilities, and her cable had been cut off. Now, keep in mind, he was living with her. She was also being sued by many different credit card agencies because Matt was hiding her mail. But Matt, however, was once Citizen of the Year for Jones County, with the peak of his career falling during the aftermath of Hurricane Katrina. And during his last year of life, he presented with massive weight loss, severe anxiety, memory deficits, depression, extreme mood changes, paranoia, excessive crying spells. Matt also took our family's coin collection passed down from our dad and spent it at a local gas station like it was basic change just to purchase Kratom. And this coin collection was being saved to be given to my son, but Matt later apologized to my son and admitted to him that he'd do anything to get Kratom, and that each day he required more and more just to feel good. After Matt's death, family members cleaned up almost 1,000 bottles of Hush, which contains Kratom, and we knew immediately what had stopped his heart. Bottles were found hidden all over the house, car, yard, woods, basically everywhere. And when he was alive, he admitted to us that he did love this drug, but he also hated it because he knew that it was destroying his life, and he couldn't go a single day without it. He had a lot of potential to do great things and had done great things in the past. And I just feel like his life mattered. And I need him so much right now, having also just lost our mom 3 weeks ago. Nothing will bring him back to us, but I just don't want any other family to have to go through this, as Kratom is cheap and sitting on all public gas station shelves and smoke shops for anyone of any ages, to purchase at any time.
Appreciate you sharing that story, and very sorry for your loss, Angie.
Thank you.
What was the catalyst? I mean, what I guess motivated your brother to start ingesting this substance?
I found on a laptop that he did not want me to get into. A friend of his said, and he really did want to get off of drugs, that in order to get off of drugs, he could substitute Kratom in the place of it. And he had no idea that he was going to become as addictive and it's little bottles of Hush that we found everywhere. So I think he had no intentions whatsoever of becoming madly addicted to it, but it really changed him psychologically, and the whole family dynamic changed because he lived with my mom. They lived right beside me. I've basically lost all of them now. My dad, now my brother, and my mom. I really just feel like he was looking for something to ease the pain of the heartbreak from his divorce, as well as he did have a lot of back pain. And he wanted to do this instead of other drugs that were basically frowned upon publicly.
So did he ever seek help, or did you guys ever encourage him to seek help?
We didn't realize the Kratom issue was as severe because of all the lies involved in the money spending. My mom would not confide in me that they didn't have anything because she didn't want me coming at him to protect our family. And it was after he died that we realized how severe things were, or we would have done anything to help him. We adored him.
I see. Wow. And over, you may have said it, but when did he start and when did he finally pass away? When did he start using Kratom? How long?
I would say since he passed away last July of 2024, it was probably somewhere between 2 and 3 years before that he started using it. And he admitted to me that it became something that he needed more and more with each passing day, and that it became something that was all that he could think about.
I see.
So after a couple of years of it getting intensely worse, July the 24th, 2024, on a Wednesday afternoon, is a horrible nightmare that I will never forget.
I understand. So, Dr. Pannel, we had someone on last week that touts the positive effects of this drug, and now we have a devastating effect. How are we, just average citizens, to reconcile that?
I mean, you definitely have to listen to the experts and even do your own research. The fellow that was on last week, I mean, there were a couple of things that he said that just weren't true, saying that you cannot die from Kratom alone, when there are numerous studies published by the CDC showing that people have overdosed and died with just Kratom alone. So it can cause death. We know this. Saying that it's not an opioid, it has been established to be an opioid. It works on the exact same receptors. And words are very important in this argument. You'll hear from the American Kratom Association that Kratom is safer than heroin or fentanyl. I mean, I think we need to look at that as, no, Kratom may be less deadly than heroin and fentanyl, but it is still deadly and it's still dangerous. I mean, the Kratom industry is a multi-billion-dollar industry, and they do a great job of marketing it. And they again tout it as being this wonder drug that's safe and all natural, and it causes no harm. But what we're doing is essentially people are trading one addiction for another.
So we received a letter, I'm sure you're well familiar with it, that was signed and endorsed by a number of organizations inside the state of Mississippi, and it's addressed to Mississippi legislators, encouraging them to support they support the addition of Kratom to a Schedule 3 of the Uniform Controlled Substances Act. So that would make it less available, right? Right.
Well, it gets it off the counters, which is the main goal. There's not jail time associated with it, so we're not looking to lock up everybody that's found with Kratom. Okay. And we did this with tianeptine a couple years ago, and it has been hugely successful. there's also a myth that we're going to create a black market for Kratom. We're not seeing that in other states that have already banned it.
I got you. Angie, we're going to let you go. Thanks so much for joining us, and thanks for coming on and sharing the story. Again, our condolences.
Thank you for allowing me to tell his story. I appreciate you all.
You bet. Thank you. Dr. Pannel, if you stick around, we'll keep talking about this. We're coming right back in the Element Wealth studio. Dr. Katherine Pannel is our guest. Okay, so what is it that you think we should do from a regulatory perspective?
I think we do ultimately need to get this off the convenience store shelves, and the best way to do that is making it a Schedule 3.
Okay.
That will, it still leaves the option if the FDA starts to study it, we get more studies. If we show that there is any benefit, this still leaves the option for us to be able to prescribe it. And it gives us the option to study it more, to figure out dosages, what to do in overdose, what to do when you're toxic. Because right now we don't even know if you overdose, we don't have a reversal agent for it. So it really... It gets it off the shelves, but leaves the option to learn about it more in case that we do find something positive. We can still be able to prescribe it.
What would you say to those like the user we had on last week that basically said this has changed her life in a positive way, but yet then we have another with Angie we just had on talking about how it destroyed her family and ultimately led to the death of her brother. I mean, that just seems like such a stark contrast in outcomes.
Right, and I feel like you're benefiting from it. You're not going to talk about or promote things that are going to make it regulated. I know she equated it to coffee, which kind of it tickled me a little bit, but what she may find down the road is that she's having to use larger and larger amounts to get the same effect that she's getting now. I wonder if she's ever tried to get off. I bet it would be a huge struggle to get off. The withdrawal from Kratom is horrible. The detox from Kratom is horrible. So, I hate to say it, but I think we really need to look at, she did get off opioids and alcohol, but did she trade an addiction? And in that case, I would say yes. Kratom is highly addictive.
I see. Okay, so, but if she chose to keep using it, she would still be able to access it, right? Even though it would be changed on the schedule.
Absolutely, yes.
Okay, so, but what you advocate for, I want to make sure I get this right, is just that it's not just sold over the counter in the convenience store as it is today.
That is right.
Is there any restriction on age today to purchase it?
No. My 11-year-old
could?
Yeah, my 11-year-old sitting behind us right now could go walk into a convenience store and get Kratom.
So why do you think this feels like it sort of slipped through the crack?
It did. They were very wise. They slid it through the cracks and termed it as a supplement. So when it's passed as a supplement, that the FDA can't get involved. They don't do the rigorous studies because it is a supplement. So they got to bypass all of that.
A supplement. Is there something special about categorizing it as a supplement?
It is. Just that it doesn't have to follow the strict, rigorous studies that the FDA requires of things that are not substances or supplements like medications.
Okay. So do we need to review perhaps the categorization standards?
I would love to see that too. I don't think it needs to be a supplement. And I do. I think that we do. I think that is one thing that we and the American Kratom Association can all get on board with, is we do have to have more studies about Kratom.
Okay. Well, I'll ask you this question as well, because fentanyl is, of course, is prominent in the national conversation. Certainly, our president is imposing tariffs in an effort to stem the flow of that. I know a lot of people will ingest it, don't even know that they are, right?
That's right.
But it's included in other substances, other materials. Don't know. Next thing you know, they're either super sick or dead, which is a big problem.
That's right.
But there are some who know they are, right? They're addicted to it.
Sure.
And they're doing it. So my concern, Dr. Pannel, it's really not a concern, more of a question, is it just feels like if people want to put that stuff in their body, they're going to do it. And somebody's going to sell it to them. How do we address that?
So I'm a lifelong Mississippian. I love Mississippi. I love patients in Mississippi. I want to protect Mississippians. I don't want us to become like in Oregon, where we just basically say, take and use whatever you want. They did that, and it has proven not to work. We have to have some regulation. The overdose deaths in the United States have fallen, except for in Oregon, where they've actually increased. And it's because of their liberal, drug policies. And I just want to get ahead of it here in Mississippi, get this off the shelves, and keep Mississippians safe.
So what's the status of any legislation to do that?
So Senate Bill 2355 looks like it's kind of held up in political limbo right now. I don't know that Representative Horner is going to even bring it up. I implore him to bring it up. I think this is the best way to go with Kratom, is making it Schedule 3. But if it doesn't, there's also Senate Bill 2354, which is in the AET committee in the House. And it will at least give the Mississippi Department of Health the regulatory ability to go in and test the Kratom that's on convenience store shelves right now.
Okay. Is there a House bill?
It died, unfortunately.
It died. Okay. So there's a couple of Senate bills.
Right.
They're sitting in House committees.
They are.
Waiting
Deadline
for,
day, just
right,
waiting to either die or move.
I got you.
Yep.
All right, Dr. Katherine Pannel, thanks so much for coming on and joining us.
Thank you.
Yep, you bet. Folks, we're stepping aside for a break. It's top of the hour. That means Fox News Super